Assalamu alaikum wa rahmatullahi wa barakatuhu, brothers and sisters of Islam. Today in this video, we will talk about all from the doctor's office, which means all from the medical perspective or point of view that would invalidate or break our fast. Let's begin. The first point, can I get a blood test done while fasting? Yes. Drawing a few vials of blood for testing purposes does not invalidate the fast because the blood is only a small amount. That included taking blood to check sugar levels. If it was a larger amount, donating blood, etc., then that would break the fast. Point 2. Injections. Any type of injection, whether intravenous or intramuscular, all are allowed during fasting except those injections that will provide nourishment to the body and act indirectly as a food and give you energy. The third point, eye drops and ear drops. It's allowed to use any of these, just avoid swallowing anything if it reaches the throat. Fourth point, nose drops or sprays. Nose drops usually reach the back of the throat, so it's not allowed to use nasal drops while fasting. Sheikh Ibn Uthaymeen said, nose drops are not permissible because the nose is an opening through which food and drink may enter the body. Hence the Prophet ﷺ said, snuff water up into the nose deeply unless you are fasting. The one who does that has to make up the fast because of this hadith and similar reports if he finds the taste of that in his throat. Fifth point, how about ultrasound? Now, ultrasound and X-ray by themselves don't have any effect on the fast itself. But if the ultrasound test requires that you drink a lot of water before the test, then if you can delay the test till after Ramadan, that's better. Or at least delay it until after Maghrib if possible. But if it's something urgent, then you're allowed to break your fast for the day if you need to drink water for the test. Sixth point, at the gynecologist, pap smears, gynecological exams, insertions or extractions of IUD, medications, pessaries, etc. all of these do not invalidate the fast, and ghusl is not due after such procedures. Point 7. At the dentist. Dental procedures like tooth extractions, root canals, fillings, cleaning, polishing the teeth, etc. do not invalidate the fast. But if water goes into the throat, it will invalidate the fast. So be really very careful not to swallow any water or rinsing material used during the procedure. And of course, if you can delay it till after Ramadan, that's better. 8th point. How about using inhalers while you're fasting? If someone suffers from asthma or other diseases where inhalers are used, they are allowed to use it. And this does not break their fast. That's because the medicine is going into their lungs and not into their stomach. As for nebulizers and steam, there's a difference of opinion amongst the scholars about that. The scholars said that steam will break the fast if the steam is a lot and you find it in the form of water in your nose or mouth. But if it's small amount, it does not break your fast. So it's best to avoid inhaling steam to be on the safer side. However, applying balm or wicks to the nose area without steam is permissible. Point number 9. How about sublingual medicines while you're fasting? Any medicine that's placed under the tongue, such as for the chest pain, it is allowed during fasting as it's absorbed through the membrane of the mouth and does not enter your stomach. Point number 10. Suppositories. They do not break the fast unless they somehow provide nutrition to the body. Now, generally speaking, suppositories do not come under the same heading or category as food or drink. Ibn Taymiyyah said application of coal and NMS do not invalidate the fast. This is the view of some of the scholars according to Al-Ikhtiyarat, point number 193. And Sheikh Ibn Uthaymeen said the most correct view concerning this matter is the view of Sheikh Al-Islam Ibn Taymiyyah, that is, an enema does not invalidate the fast. This is also found in Al-Shar Al-Mufti 6/381. And Allahu Alam, Allah knows best.